ومحياهم ومماتهم ساء ما يحكمون. وخلق الله السماوات والأرض بالحق ولتجزى كل نفس بما كسبت وهم لا يظلمون. أفرأيت من اتخذ إلهه هواه وأضله الله على علم وختم على سمعه وقلبه وجعل على بصره غشاوة فمن يهديه من بعد الله أفلا تذكرون. وقالوا ما هي إلا حياتنا الدنيا نموت ونحيا وما يهلكنا إلا الدهر وما لهم بذلك من علم إن هم إلا يظنون. وإذا تتلى عليهم آياتنا بينات ما كان حجتهم إلا أن قالوا ائتوا بآبائنا إن كنتم صادقين. قل الله يحييكم ثم يميتكم ثم يجمعكم إلى يوم القيامة لا ريب فيه ولكن أكثر الناس لا يعلمون. ولله ملك السماوات والأرض ويوم تقوم الساعة يومئذ يخسر المبطلون. وترى كل أمة جاثية كل أمة تدعى إلى كتابها اليوم تجزون ما كنتم تعملون. هذا كتابنا ينطق عليكم بالحق إنا كنا نستنسخ ما كنتم تعملون. فأما الذين آمنوا وعملوا الصالحات فيدخلهم ربهم في رحمته ذلك هو الفوز المبين. وأما الذين كفروا أفلم تكن آياتي تتلى عليكم فاستكبرتم وكنتم قوما مجرمين. وإذا قيل إن وعد الله حق والساعة لا ريب فيها قلتم ما ندري ما الساعة إن نظن إلا ظنا وما نحن بمستيقنين. وبدا لهم سيئات ما عملوا وحاق بهم ما كانوا به يستهزئون. وقيل اليوم ننساكم كما نسيتم لقاء يومكم هذا ومأواكم النار وما لكم من ناصرين. ذلكم بأنكم اتخذتم آيات الله هزوا وغرتكم الحياة الدنيا فاليوم لا يخرجون منها ولا هم يستعتبون. ولله الحمد رب السماوات ورب الأرض رب العالمين وله الكبرياء في السماوات والأرض وهو العزيز الحكيم. صدق الله العظيم.
Or do those who earn evil deeds think that we shall hold them equal to those who believe and do righteous good deeds in their present life and after death? Worst is the judgment that they make. And Allah has created the heavens and the earth with truth, in order that each person may be recompensated with what he earned, and they will be not wronged. Have you seen him who takes own lust and his ilah, and Allah knowing left him astray, and sealed his hearing and heart, and put a cover on his sight? Who then will guide him after Allah? Will you not remember them? And they say, there is nothing but our life of this world. We die and we live, and there's nothing to destroy it except time. And they have no knowledge of it, they only conjecture it. And when our clear verses are recited to them, their argument is no other than they say, bring back our dead fathers if you are truthful. Say to them, Allah gives life, then causes you to die. Then he will assemble you on the day of resurrection, about which there is no doubt, but most of how mankind knows not. And to Allah belongs the kingdom of heaven and earth, and on the day of the hour will be established, on the day of the followers and falsehoods. Disbelievers, worshippers of false deities, shall lose everything. And you will see each nation humbled to their knees, kneeling. Each nation will be called to its record. This day shall be recompensated for what you used to do. This, our record speaks about you with truth. Verily, we were recording what you used to do. Our angels used to record your deeds. Then, as for those who believe in the oneness of Allah and did righteous good deeds, their Lord will admit them to his mercy. That will be the evident success. But those who disbelieve, it will be said to them, were not our verses recited to you, but you were proud and were a people of the mujrimun. And when it was said, verily Allah promises its truth, and there is no doubt about the coming of hour. You said, we know not what the hour is, we do not think of it but a conjecture, and we have no firm convincing of believing. And the evil of what they did will appear to them, and which they used to mock at will completely encircle them. And it will be said, this day we will forget you as you forgot the meeting of the day of yours. And your adobe is fire, and there's nothing to help you. This because you took revelations of Allah in mockery, and the life of the world should be deceived by you. So this day they shall not be taken from Jahannam, nor shall they be returned to the worldly life. That they repent to Allah and beg his pardon for their sins. And his is the majesty of the heavens and earth, and he is the Almighty, the All-Wise.
Jazakallah khair.
Jazakallah khair, Brother Ali, and your son. MashaAllah, he has a very solid voice. May Allah keep him firm, inshallah, in the faith. So I wasn't able to find a true moderator. So I'm going to, inshallah, after a little introduction, hand it over to Dr. Sameh Mubarak, who will proceed, inshallah, with being the moderator of the session as well. Hopefully we will have a interesting panel discussion with both the distinguished guests today. And I encourage everybody to join our meets, inshallah. Tomorrow we will have possibly a Boy Scouts meet as well. So just letting you know to join that in. And with that, inshallah, I give you Dr. Sameh Mubarak.
جزاك الله خيرا. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. والصلاة والسلام على سيدنا محمد وعلى آله وأصحابه أجمعين. اللهم اشرح لي صدري ويسر لي أمري واحلل عقدة في لساني يفقهوا قولي. Tonight I'm going to give just an overview about the coronavirus and the infections that the whole globe is facing as a pandemic. I'm sure that a lot of you will probably have some of this information. They're just going to give you just again as overview, and after that we'll open the floor for all questions, and hopefully we'll have some of these answers to you. So the coronavirus has been actually known for us since the early in the 19th century. It is not new to us. It is very familiar to us as a form of cold, upper respiratory infections, and so on and so forth. The coronavirus is called the corona because the structure of the organism itself. The virus, as you probably know, it is not seen by the naked eyes, is not seen by a regular microscope. SubhanAllah, it's seen only by the electron microscope. And in order to see such an organism, you need to magnify that organism 100,000 times. So just to get that in perspective, if you imagine the virus is the size of a grain of rice, in order to see this grain of rice and you're not able to see it, you need to magnify it to the size of 6 soccer fields at least in order to be seen. Such a virus in and itself is really weak virus. In fact, you can imagine that all these instructions and precautions and prevention method about just washing your hand with water and soap can just knock off this virus. And yet this virus becomes deadly. The coronavirus is, again, has been known to us. Well, actually now we identify at least 7 kinds of coronavirus over the years. And they typically, as a group of viruses, lives among animals or in animals. But somehow along the way, they make their transmission from the animals into the human beings. And if you look historically at all the viruses that has been around the world for a long time, you can have the similarity of the plague in the old times. I would like to remind everybody, and you can actually go and look, as the worst pandemic the world knows so far. There is a difference, by the way, of epidemic and pandemic. When we say epidemic means a local area, but when we say pandemic, that means it involves the whole globe. The worst ever pandemic that the world has seen is actually called the Spanish flu. The Spanish flu happened in 1918, around World War I. And at that time, it afflicts 500 million people. That number is equated to almost half the globe, the population on half the globe, out of whom 50 million people have died. They have nothing of sort of vaccine at that time. They actually resort to using masks, washing hands, sort of the same preventive methods that we have. And actually the pandemic lasted for good 2 to 3 years until it went away. Fast forward, we've seen in the 1980s, the HIV, that's not a coronavirus, but in 2003, we saw SARS. SARS basically stands for severe acute respiratory syndrome, and that's started in China, and it actually also became pandemic. Fast forward about 5-6 years afterward, 2008, 2009, we saw MERS, another coronavirus strain. It's called the Middle Eastern Respiratory Syndrome, and that Middle Eastern Respiratory Syndrome actually showed up in Saudi Arabia, and we might have remembered some of that. Fast forward another 5-6 years, we saw the Ebola virus in Africa and the Zika virus also. And then fast another 5 years, and now with COVID-19. COVID-19 was called by that name by the World Health Organization. It stands for CO, that's a corona, VI, that's a virus, and D is disease, and 2019 is the year that was discovered. Was discovered in first cases in Wuhan city in China, and we believe that it's been actually localized to a large food and seafood market in the city of Wuhan in China, where it started. It's called the coronavirus because the virus itself, subhanAllah, is composed of material, genetic material, DNA, inside, and it has an envelope around it. And around that envelope, out of this envelope, there's a spikes that comes out of it. These spikes are made of another protein, glycoprotein, that is actually allow this virus, when it's land, to attach the surface. And we'll come to that, the importance of this later on. We don't know exactly how the transmission took place from the animal into the human being, but there is a speculation that it made it through bats in China. The Chinese actually announced this, although I think some people believe that the numbers were underestimated, and they waited for some time. But in December 2019, they announced the cases of the COVID-19 or the coronavirus. And only in less than 3 weeks later, the Chinese actually were able to isolate the virus, to isolate the molecular DNA and structures of it, and they published. And of course, once that published, a lot of companies went after it in order to produce the vaccine or the treatment for it. So the coronavirus actually has a very resemblance to the Ebola virus has a resemblance to the SARS virus. It's another form of coronavirus, but genetically it's about 80 to 90% very resemblance to it. Now, when we go back to the time of the Ebola and the Zika as it hit the world, actually at least quite a few companies went out to make a vaccine. But subhanAllah, once the Ebola and the Zika virus subsided and the epidemic did not really reach any huge global wide, the company stopped pursuing the vaccine against the Ebola and the Zika. And now really we come now to learn that as the COVID-19 explode around the globe, we learn from this lesson that this time they're gonna go after a vaccine, hopefully, that may cover all the coronavirus in the future as well, because some of these viruses, as we know, mutate. You are definitely aware of these symptoms: the high fever, at least 100 degrees or more, cough, fatigue, shortness of breath, body aches. And lately, the CDC and the World Health Organization added the loss of a smell and the loss of taste as also some of the mild symptoms that you should watch for it. The good things about it is that the hospitals around the globe has been prepared, and talking about our local community here, all the hospitals took actions, all the hospitals have a preparation team. We know exactly if COVID patients has been identified, they're right away been isolated in a special unit. The team goes in hazmat suits and they take care of them. And so far, we are aware of at least 2 cases in UNC, maybe also similar or a little bit higher numbers at Rex Hospital, similar numbers also at Wake Medical and at Duke as well. So we're in a blessing, although we're still waiting for that wave to happen, that we are anticipating more COVID patients to be in the triangle, and we are prepared to take care of these patients. Of course, we have to look into the distribution of these, looking at the major cities that got hit. For example, New York City as number 1. Although New York City just today hit at or just past the peak, although now it shifted, unfortunately, to Rhode Island with much more cases now announced there. The other areas, New Jersey, Los Angeles, New Orleans, Atlanta as well, Michigan. And if you really look at these cities, they're major metropolitan areas, and they have major airport hubs. So that's make the transmission of the virus and the spread of the virus much easier. So far, worldwide, we have over 1 million cases of COVID-19, 600,000 deaths. In the United States, as of today, we have a little excess of 300,000 cases, out of which 8,000 have died. When you track the mortality rate, which has not really changed much since the spread of the virus, it's about anywhere between 1 and 3 or 1 and 4%. And of course, it depends on the area where it's prevalent is. What about the treatment? We have no treatment so far for the virus itself. We know of several companies, about 35 companies and academic institutions are pursuing the vaccine. Traditionally, and historically, when you make a vaccine, the idea is to take the virus itself and either weaken that virus or kill it. So now you have a protein that's weakened or dead, and you inject it into human beings. The human being's immune system will build antibody to fight it. Then you isolate that antibody and you take it and you start to make a vaccine and a huge amount of it, and you start to try it on phase groups per small patient, phase 1, then you go to phase 2, phase 3. So typically, in order to make a vaccine for a brand new virus, it takes anywhere between 3 and 10 years. That's the typical historically that we learn of, either to take the virus, a part of the virus, kill it or weaken it, inject it into the human beings, let the immune system identify it and build antibodies against, and then you isolate the antibodies. We cannot afford to do that with coronavirus, and that's why the world view of vaccine has completely changed with the COVID-19. Now, what they're pursuing is actually to look at the part of the virus that makes the spread more widely, which is, subhanAllah, these spikes that project from the envelope around that virus that's made of glycoprotein. And they looked at the genetic material, the DNA and RNA that is made off of these spikes. And once they have that in a computer, they can build a vaccine theoretically in a computer within a few hours. Of course, the fact of the matter is you have to isolate this. You have to, again, to try. But instead of 3 to 10 years taking a vaccine, now Anthony Fauci, who's the head of the NIH Allergy and Infectious Disease, said that it would take probably 12 to 18 months to build such a vaccine. But again, we're not there yet. The vaccines have to go through phase 1, phase 2, phase 3. They already start phase 1, which is in animals, and now they took it into phase 2. We know of at least 2 companies, Moderna and Inovia. One of them is based in Boston, and the other one is in San Diego, California, that they already start doing their own studies in the University of Nebraska and in Seattle, Washington. So these vaccines have been pursued actively, but we're not there yet. There's other companies around the world, the CureVac from Germany and the CanSino from China, also pursuing sort of a similar genetic material from the virus itself. So that's a prevention, and you have to understand that when you take that, you still need to see who's going to produce it. And if you produce it, who's going to take it? And unfortunately, the underdeveloped countries, because they don't have the resources, will be, of course, the unfortunate to less chance to get it. What about any antibiotics or the treatment? Again, we do not have any approved treatment whatsoever. I'm sure some of you have heard of the malaria drug, known in Europe as chloroquine and in the United States as hydroxychloroquine. This is a drug that's been available for many, many years. It's been used for malaria and among other things. But we have no really a well-done trial. Some people in France, some physicians in France, and actually some anecdotal report in some of the patients out in Michigan, some of the physicians actually give it to patient that's really sick. And they found out that the course of the illness have actually shortened. But again, we don't have a really well trial. There is a very promising antiviral antibiotics. It's called remdesivir. Remdesivir is currently undergoing phase 2 trials, meaning it started in human beings. And it, again, was still kind of far from that. The good news is that a significant amount of patients get recovered. The Chinese publish the data on who is at high risk of developing the disease. These are, by all means, the elderly. That doesn't mean that the younger will take it, but definitely will get it. But definitely the elderly are more. Patient with hypertension, patient with congestive heart failure, patient with diabetes, and patients with emphysema or lung disease. These are known, again, this is Chinese data, not duplicate in the United States, but this is what the Chinese at least published so far about who is at risk. The good news, again, there's a small number of patients that will really become severely ill that they need to go on a ventilator. And the ventilators, as you probably know, there's a shortage, but the country is trying to produce more and more. Some people getting with ingenious ideas about how to ventilate several patients with one ventilator, and so on and so forth. One of the interesting things in this group of patients that become severely ill, subhanAllah, is that when, I want you to imagine you're going to visit a patient on a ventilator in the hospitals. What you typically see, the patient is laying on his back, and he has a tube on his mouth. And he has all this IV lines, intravenous lines, and all these drips going through him. He might have a catheters in the bladder. But what we found with this so far, this virus or this infection, there is something called proning, which means if you take that patient and you flip him on his tummy. Now imagine all these lines, all the ventilators and all these tubes coming, this has to flip with the patients, and he's on his tummy. And you do this anywhere every day, twice, between 12 and 18 hours, meaning that 12 to 18 hours, the patient will be on his tummy, and then you flip him on his back, and then you repeat this cycle over and over again every day. They found out this patient, subhanAllah, they actually recover quicker, and they have a shorter hospital course, and they have a better prognosis overall. Again, we just learned that over the last few months since this got hit with us. So again, the most important thing for us to do is actually the prevention. And I'm sure that all of you are aware of that. That washing our hands, which according to our sunnah, alhamdulillah, you wash before you eat, you wash after you eat, you wash before after you use the bathroom, you wash your hands when you go out, or sorry, when you come in. Just be on it, and it has to be at least for 20 seconds, preferably with soap and water, and paying attention to the rubbing and details of this washing mechanism. The CDC actually just announced that now it is probably advisable for us to wear a mask going out. Unfortunately, I have not seen it universally, and maybe because we're still not in a high infected areas, just like New York City or Rhode Island or LA. But that's what the CDC said. Cloth-made a mask should be worn by all people in public. And of course, if you go in public, keep that 6 inches distance away. What we know is 6 feet away. What we know is the virus can travel at least 3 feet away. And that's why the doubling the 6th to be on the safe side. So that's why the 6 feet rule, to keep that distancing. But really the best thing is social distancing. And the anticipation by the end of this virus is that the initial anticipation from the CDC that maybe 100 to 2,400 will die from this. But unfortunately, what they're seeing, the number may be higher. Why? Simply because people are not getting strict with the social distancing. And unfortunately, we might see this more and more. People eventually will get tired, will get sick of being home, and they might not do that. But we need to keep our boundaries. We need to keep that social distancing because it's the best preventive way, based also on our sunnah from the Prophet sallallahu alaihi wasallam. I'd like to stop here, and I might have taken over my time, although I'd have to have much more, but we'll open the floor, inshallah, to any questions.
Bismillah ar-Rahman ar-Rahim. Everybody hear me?
Yes, we can hear you.
MashaAllah, Dr. Sameh gave a very comprehensive presentation, taking us from the historic perspective of the endemics and the pan-endemics to the microstructure of the viruses. I would like to add some points, practical points, that the incubation period of the disease can extend up to 14 days from the time the person got infected to the time of having the symptoms. And the medium, the average, it is from 4 to 5 days from the exposure to the virus to starting the infection or the symptoms. Yet, not everybody got infected is going to have symptoms. Studies saying that from 13 to 50% of people who got infected, they will be totally asymptomatic, no symptoms. But as far as the most common symptoms, as you know, is fever. It is from 83 to 99% of people who got infected will have fever. Cough, 60% to 82% people will have this cough. Fatigue from 45 to 70%. Shortness of breath from 30 to 40%. There's another uncommon symptoms like headache, confusion, vomiting, diarrhea still can develop. Not everybody got the disease will have the same level of illness. They categorize them into a mild to moderate stage. And this will be about 81% of people who got infected will fall in this category. And those from mild symptoms to even mild pneumonia is still considered from mild to moderate. The second category is severe stage, which usually it has the symptom of shortness of breath, dropping of the oxygen, hypoxia, what we call it hypoxia, drop of the oxygen level in the blood, and getting the lung got involved about 50%. Those categories about 14% of the people. And then the most severe category, what we call it critical stage, which is, we call it a stage of respiratory failure, shock, multi-organ failure, and those patients eventually will be hospitalized, and those falling about 5% of the people. As Dr. Sameh mentioned, that the fatality or the chance the people who got the infection will die, it is in the average about 2 to 5%, 2 to 4%. But we have to understand, if somebody become critically ill and he has been hospitalized and been on a ventilator, the chance that he will die is about 50%. So it's 50% that he will die. The people who have underlying lung condition, their chance to die is about 10%. So it's still fatal when people develop the critical stage or have this critical stage. Again, I would like to stress on the high-risk people, elderly people 65 and above, people who live in nursing home facilities, people with lung disease, moderate asthma, serious heart condition, immunocompromised people. Obesity is high risk. If somebody, his body mass index is above 40, he is a high risk. Chronic kidney disease, chronic liver disease, and so on. From practical point of view, if you develop a cough and fever, don't be panic. Watch yourself for the warning signs. What is the warning signs which force you to get in touch with your doctor? Is trouble breathing, persistent pain and or pressure in the chest, new confusion or inability to arouse, bluish limbs or face. Those are the warning signs. You have to contact your doctor and you need to get medical attention. One thing I would like to address about many people about asking about it, which is the testing. Who is going to be tested? Who is not going to be tested? We have to look in the broad picture about the availability of the testing and the priorities. We have to look for the society at large. So the first priority, or people at most need to be tested, those who have hospitalized patient with the above symptoms, which meaning the fever, cough, shortness of breath, those has to be tested for coronavirus. Second, the health care workers with symptoms. If somebody, a doctor or a nurse or paramedics develop a symptom, this is the highest priority, in a sense that those are the people who are working to take care of the society and the community. So we have to test them for two things: to keep those people functioning. Second, to prevent the spread of the disease to their patients. Yeah. The second level of priority of the people in the nursing skilled facilities, nursing home with symptoms. Patients who are 65 old and above with symptoms. Patient with underlying medical condition with symptoms. And the first responders, the EMS as mentioned. The third level, or the lowest level of priorities to be tested, if the sources allowed and people to anybody in the community with above symptoms, he has to be tested. But if any individual without no symptoms at all, this should not be tested at all. Yeah. So I think this the practical point. About I would like to address on the hygiene and the social distancing and the washing, or hand washing is extremely important. The virus can stay viable on the surfaces for up to 14 days. So we have to change or increase our awareness that social distancing is extremely important, 6 feet or more. Second, do not touch our face without washing our hand. This is extremely important. The skin is the most strongest and the most protective barriers or protective organ Allah subhanahu wa ta'ala has created to the human beings. But in the face, there are weak points, which is the mouth, the nose, and the eyes, with the structure of completely different from the structure of the skin. And in these spots, the virus can penetrate and go easily and invade the body. Besides that, the good hydration, hydrate yourself well through the day, eat healthy, exercise. This is extremely important to give your body in a good shape, because as you know, and as you see, in most of the cases, we depend from Allah subhanahu wa ta'ala. Protection who has created us is the immunity of the individual to fight that infection. So with that, I will stop, and I'll be glad to take a question with Dr. Sameh. Jazakumullah khair.
Dr. Hisham, inshallah, we have few questions. So Dr. Sameh, if you want to basically lead the effort of gathering the questions, and between you and Dr. Hisham, if you can answer those, inshallah, within the time limit. Jazakallah khair.
Assalamu alaikum.
Fadda, Sam.
I have a quick question. For the patients who has both of mild asthma and acid reflux, so both of them sometimes they develop actually cough, and there is no fever. In this case, do we need to go for testing or no?
As I mentioned, brother, that from 83 to 99% of people who have the disease will have fever. So we cannot go with a single symptom like difficulty in breathing, which is the people who have asthma aware of it and know it, and they suffer from it through their life. So I will not test that person who's just developed difficulty in breathing, which is sound from the history that he has asthma, and most likely it is asthma flare symptoms with him. I will not test him.
I agree with Dr. Hisham.
Is there Assalamu alaikum, Hamdi Radwan, كيف الحال?
Wa alaikum salam, Dr. Ham.
So I have a question. My wife has a question as well, so maybe I will get you there. One of the things that when we teach the medical professionals say that there are a specific number of testing that will build up and increase the sensitivity and specificity of the test. Are there any like collection of testing that has to be done, like I mean of signs and symptoms, that testing has to be done, like fever and or respiratory problem, and these are too high that they have to be tested? In other words, what are the things that I look at that if I have it, I must call my doctor right now?
I think that the high grade fever, not the low grade fever, like I said, at least 100 or 101, plus the shortness of breath, that will make the most probably. But again, we've seen this in the hospital, and in all the hospitals in the Triangle, there's lots of people got tested, and lots of them are negative. So there will be, precautions taken and everything, but especially in the background of somebody that the immune system is not well, that maybe an elderly person, maybe a resident of a nursing home, maybe have some of these risk factors that will trigger the testing faster than usual.
I would like to add that the current health department recommendation, if somebody has these symptoms and having trouble breathing, fever, cough, shortness of breath, and start having trouble breathing, first step is to look for other viruses could be behind. So we usually we test them for the influenza A and B, and if it is negative, and if he has a history of potential exposure to sick people or has recent traveling, this is a candidate to be tested for coronavirus.
The panel that we have in the hospital, for example, it tests for at least 14 types of virus. So if they suspect, if you're a COVID suspect, a blood sample and a swab will be taken, and that usually the turnaround is less than 24 hours, and it has at least 13 or 14 virus that is known to cause upper respiratory tract infection or pneumonia.
My wife.
Okay, السلام عليكم.
عليكم السلام.
وعليكم السلام.
يا ترى في أي relation between إن الواحد ياخد vitamin C for as protective? Yeah, because I heard many doctors before they said or recommend to take vitamin C with high milligram.
It is well known that vitamin C is improving the immunity.
Yes.
Zinc also, it is supplement is improving the immunity. Even I heard in the NBR there's a doctor in Chapel Hill giving vitamin C as IV infusion. Yeah. So vitamins, it is not a bad habit, but we should not neglect the natural things. Vitamin C is available in many the citrus, the orange, many things, and so we have to depend on the natural things more. Yeah.
So, Dr. Hisham, how about all these people that coming said that vinegar, wash your mouth with the salt and water, and all this? There are lots of Facebook postings and things. What do you think about it?
I did not hear. There is nothing proof about the vinegar, but we use the gargling with warm water and added some salt in it. Even in any viral infection, it helped to get rid of the sticky secretion in the throat and in the nose. Even you can clean and snuff your nose with it and a couple of times. It is not a bad idea to do that. But hydration is extremely important. And I would like to add this, we are very close to Ramadan, inshallah. This is my recommendation, is to gargling and mouthwash during the fasting, even if you are not sick, with warm water and adding like half teaspoonful of salt to it, and stir it and gargle with it frequent through the day. I started hearing from people about raising the question about the Ramadan. In my opinion, that if you are feeling healthy, and follow the guidelines and hydrate yourself well, and take suhoor and drink a good amount of fluid. You do fast, but if you at any point, if you feel not feeling well, feeling weak, and you don't feel well, and of course, if for the people who have chronic illness, if you feel that you are not feeling well, you should break your fast and fast later on. Yeah. This is my opinion.
Jazakallah khair. We had a question or a hand raised from Walid. If you want to unmute and ask the question.
Yes, Assalamu alaikum, jazakumullahu khairan for the useful information. Actually, partly my question is answered throughout the other questions. But I have one question that some people are tested positive, and yet they are not admitted to hospital. They are ordered to stay at home. And I'm not sure what they take when they are staying at home waiting for other symptoms to appear, or hard breathing or anything like that. What should they take while they are waiting at home? Or, and also the same question, if people are curious whether they have it or not, but they don't want to take the hassle of going to be tested while they don't have much symptoms, what they should take to reduce the fever or to reduce the coughing and things like this. Jazakallah khair.
The patient that get they're asymptomatic and they go home because they have no symptoms, they just watch for symptoms, but there's nothing really that they can take because the chloroquine has not really been proven of anything to prevent it. Maybe again, just the usual preventive measures and the vitamin C and the zinc and all that. But we know, like Dr. Hisham says, it's average about 25%, or what we call it, asymptomatic carriers. Actually, the CDC just announced that the patient actually that COVID positive, they can go back to work after 3 days or so. And even if they get afflicted or so with the disease, once the fever subsided and all this, he can go back within 7 days. But I mean, again, it's a general rule. But the patient, the patient that will have the personnels or the individuals that have COVID positive but no symptoms, there's really nothing that we know of that is going to prevent anything. It's interesting things that we also don't know what's the future of this that virus. Some of the CDC speculate that this is just a different type, although it's a severe type of flu. What we know, the virus usually does not survive in a high temperature, so maybe by the end of summer, and that's why we anticipate that the peak will go down eventually. But comes next year, there's a speculation that we might go into social distancing again. That's still unknown. So,
I would like to add. You hear me? I would like to add the recommendation if somebody got these symptoms, fever and cough, and has not been tested, the recommendation is to stay home. He should isolate himself in a separate room. Don't share the towels and the utensils and all this with the other people. And he should keep himself in this self-quarantine till 3 conditions fulfilled. That he has no fever for 72 hours without taking medication, and the symptoms has been improved, and at least 7 days has passed since the symptoms have started to appear. So these are the 3 criteria. But if the person has been tested and he came positive, he will stay home. Of course, if he come positive, the health department will contact him. They will do surveillance and testing for the people close contact to him, and he has to stay at home till, again, has no fever for 72 hours, symptoms has improved, and then he has to be tested 2 times negative within 24 hours. At that time, this is the time he has been to be taken out from the home quarantine.
Yeah, there was just a few questions that I've seen. One of them is the blood pressure medications. If I read the question right, there was concern lately, again based on a Chinese data, on a small limited data, that patients that have taken a specific type of blood pressure medications may be at high risk for contracting the disease. But some other people think it's actually a double-edged weapon, that it might actually protect them down the road. But the consensus so far is that if you are on this medication, don't stop it. But if you are identified or diagnosed with high blood pressure, we do not start that type of medications on you. This is a specific, what we call an angiotensin related receptor enzymes blockers. That's kind of the consensus, at least, although not a whole lot of data behind it.
A supplement on that one, doctors on the panel, is a child on a immunosuppressant medication, are they considered high risk?
Yes, immunosuppressant patients are considered definitely at a high risk. I know the question was about a child. We know for a fact that the children in general, there are, of course, they can be prone to infection, but the symptoms and the severity of the illness is much, much less in them. But that would change the pictures if these children are immunocompromised.
Dr. Hisham, if you want to add, please.
I concur and agree with Dr. Sameh had mentioned. Also, there's a question raised about medication, the Advil, what we call it non-steroidal anti-inflammatory medication, which used for back aches and arthritis. Things has been flare in the media about this can increase the risk of contracting the infection. It has not proven up till now. So if somebody is using this, no problem, no harm, continue using that.
There is a question about blood donation.
Yeah, go ahead with that, and then Assam will go next, inshallah.
Yeah, the blood donation is, definitely it can be done. It's needed. We might not be at that phase yet, at least in the triangle area, but it's definitely coming.
Go ahead and ask your question, please.
First of all, Assalamu alaikum everyone, and thank you for this important topic. And I have a few questions in here.
Well, I take one question only first, because we have a couple of rounds. Inshallah, we'll come back to you. So if maybe 2 questions, inshallah, go ahead.
But first, washing the hand reason, if no one comes in or no one goes out, is there is why the reason for like freaking out and like washing the hand as long as you're home. Is this only mandatory if you're like going out and coming back and that's it? And the second question about the immune system. How is the immune system going to react if like one having like the coronavirus mild case and he survived of it? Is that he's going to be like okay to go out after that? Is the immune system will handle not having the virus again, or is there going to be at risk, or it's too early to tell about that matter? Thank you. Assalamu alaikum.
Yeah, I think I get the second questions, which is if the patients got infected and recover and all this, there is a less chance for that patients to get reinfected again. But again, this is really too early because we're assuming that person that survived the infections developed antibodies. But we still in the early phase of that.
The first question was, Dr. Sameh, was for washing hands. Do you wash your hands when you come from outside only, or while you are at home, you keep washing it?
Some people advocate that even at home use it. Just the most important thing is that if you clean that, if you are taking care of the house and cleaning and also in a clean state, and you don't touch your face, nose, then it will be okay. But some people that said maybe every hour or two that you should be washing your hands. But I would say at least if you not outside and if you keep the houses in order and if you're not touching your face or nose or the kind of thing, then you're okay.
But also,
I would recommend anybody before eat. Once he come home, he wash his hand thoroughly. Before he eat, he wash his hand thoroughly. If he wants to touch his face, he has to wash his hand thoroughly. You have to understand. You have to assume any service you touch it has a potential possibility to have the virus in it.
Right.
Okay.
Because at home you have the mail, you have something coming from outside.
Exactly.
You don't know it, so you should be careful. Yeah.
The money, the currency in hand.
Yeah.
Yeah.
So just a follow up, like you mentioned that there is some blood pressure and heart medicines that are doubtful. What are the names? Do you know?
This belongs to a class of angiotensin receptor blocker. So the most common use in that class, like losartan, valsartan, telmisartan, olmesartan, and irbesartan. This is the specific class. It's called ARB. But anything else, that's the only one.
And also the AC inhibitors, enalapril, lisinopril.
Yeah, that's true.
Yeah.
Okay, alhamdulillah. Take a question from a new person.
Because actually, a few hours ago, I heard that within 4 or 5 days, kind of sumum or disease come all over the world from somewhere. So be careful. Start from April 6 to April 20. So what really do you expect about will happen within next coming few days?
Okay.
So I think Dr. Sameh and Dr. Hisham mentioned several times the peak and the when and next week. That's mentioned several times, and I think that Brother Khaterah also is asking about the same thing. What are the peak? Why are we expecting that more people coming to maybe to North Carolina will be higher in rates? What is that for?
Is based on the data from other cities that we've seen. And of course, the more compliant the population with social distancing and everything else, will flatten the curve quicker than usual. But the estimated day in the triangle area is April 23rd. That's what we anticipate. That's when we're going to get the peak.
So is that the second wave you're talking about, Dr. Sameh?
No. This is for our area.
Oh, okay.
That's for our area.
Okay.
ربنا يسلم يا رب. ربنا يسلم.
يا رب إن شاء الله. يا رب إن شاء الله.
جزاك الله خير مولانا وحمدي.
There's a question about losartan. Again, if you are taking losartan, you do not have to stop the medication. Just keep it on and use your usual precaution preventive measures.
Also, we had few people coming in a little bit later. So if you have questions, this would be the time to ask before I go ahead and see the
Brother Ikram,
scrolls.
I'm sorry, I have just
Sure, go ahead.
Dr. Hisham unintentionally mentioned that the doctors and the nurses and maybe the medical emergency people that they are more involved with and more susceptible to infection. However, also physical therapists as well. That I want
of course.
I want you to make dua for 3 physical therapists in New York area. They are tested positive, and 2 of them are mass member. May Allah subhanahu wa ta'ala cure them, inshallah.
I mean,
Jazakallah. We'll have dua inshallah at the end, so we will pray for that as well. Jazakallah khair, Dr. Hamdi, for reminding us.
There was a question about wearing a mask, why the CDC recommend the mask in the public. Simply because there is some just heightened awareness, some maybe a new data that came that it's an airborne and it can be in the air. Again, we would not. I'm seeing the people here not really universally applying it, but this is what the CDC recommends, and it stems for. Based on area that is high rate of infection. But if you have the means to do it, I would say, go ahead and do it.
The CDC does not call it as mask now. If you are asymptomatic and you go in public, you have to, as you mentioned, that it's called cloth face cover, which if you go to the general surgeon, have YouTube how to do it homemade at home. You get an old T-shirt and cut it and then fold it 4 folds, and then get a rubber band on the edges and fold it on the rubber bands, and just carrying it. Very simple method of creating, if you don't have a sewing machine or anything to sew. Yeah. It is everybody's going to wear niqab. Don't neglect that. It is because, as we mentioned, there is high percentage of people who are symptomatic, from 13 to 50% who already contracted the disease, and they are asymptomatic. Yeah.
There was a last note about maybe it is early to prove anything, but is there a really study about blood types and responding to that?
Hey, there was a study over the internet saying that some kind of blood type, like blood O, it have a better resistance to the virus than blood type A. I know it's too early to prove something like that, but did you hear about that from or something like it?
So I understood from you that you have a study somewhere that's saying blood type O has better immunity to this COVID virus. What was the last part? I missed that.
They were just saying that blood type A is the worst with this corona.
I'm not aware of any specificity about the blood type.
Is there a stockpile we should have in our home in terms of medication, and grab the prescription from the doctors before it gets worse, or Allahu Alam? Any recommendation?
The only thing which has been, maybe you have it, and I believe everybody have it, which is the antibiotic medication like Tylenol or Advil. Some vitamin C. You will never find it now, vitamin C over the counter, but I'm sure everybody have some of Tylenol or paracetamol. Other than that, we should not be panic. Eat healthy, exercise. This is the most important. Yeah.
I concur with Dr. Hisham. There's nothing really specific.
Assalamu alaikum. I just want to say, if anyone, as a pharmacist, we recommend to all our patients that you have at least 90-day supply of all your medication, maintenance medication like blood pressure, diabetes, asthma, all that medication, and the insurance actually approve them, and they give us a code to put in as early refill, because right now they're changing the hours for all the pharmacies, and they do mail out. So if everybody has their maintenance medication, not for shortage or anything, because we have abundant supply, nothing to scare anyone, but just to have their medication because of the lockdown, they're changing the hours. So it'd be more convenient if you have your medication at home.
Jazakallah khair. That's a great advice.
Yeah.
Yes, inshallah. just God forbids we come to a point that there are no enough ventilators around. I hear through the TV, of course, that CPAP machines and BPAP machines can, help to some extent in situations like this. How true is that? What is the basic differences between those types of basic machines or, very unsophisticated machines and the ventilators? Please clarify this. Thank you.
The CPAP and the BiPAP, they definitely been shown to help, but it's usually in the early stages of the disease, meaning that you have all the symptoms plus your oxygen level is low, but not enough respiratory distress that you would need the ventilator. And when you looked at this, use the CPAP and the BiPAP, it's actually lessen the chance for the disease progression and lessen the chance for the patient to go on a ventilator. So yes, it's helpful.
All right, I think that would be it for now, inshallah. Yeah, please go ahead and conclude the session, Dr. Sameh.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على سيدنا محمد وعلى آله أجمعين اللهم ارحمنا فإنك بنا راحم ولا تعذبنا فأنت علينا قادر والطب بنا فيما جرت به المقادير اللهم اشرح لي صدري ويسر لي أمري واحلل عقدة في لساني اللهم آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار اللهم انزل على أنفسنا السكينة والطمأنينة والهدوء اللهم ارفع عنا الغم والهم والمرض والسقم برحمتك يا أرحم الراحمين اللهم جئنا إليك رافعين أكفائنا إليك يا الله فلا تردنا وارحمنا واغفر لنا وانصرنا على ما عدانا يا الله اللهم ارحم الأمة كلها وارحم المسلمين وغير المسلمين في الأرض وأنزل علينا الشفاء العاجل يا الله على كل مرضانا وعلى كل أبنائنا وأحبابنا يا رب العالمين سبحانك رب العزة عما يصفون والصلاة والسلام على سيدنا محمد وعلى آله وصحبه أجمعين.
Jazakallah khair again for everybody attending. Inshallah, we'll see if we can upload this to be video on the YouTube channel. You can see it over there. Jazakallah khair for attending. And thank you very much, Dr. Hisham and Dr. Sameh Mubarak for your insight, inshallah.
Stay safe.
جزاكم الله خير.